High blood pressure due to snoring? Yes, that's true. It definitely can. While many people joke about snoring being a noisy habit, it is often the loudest warning sign your body gives that something is physically wrong. In the medical world, the concern isn't just the noise, it's the oxygen deprivation and the strain on your heart. 1. Cardiovascular strain. Snoring, especially when it's a symptom of sleep apnea, is a major stressor for your heart. High blood pressure. When you stop breathing or struggle for air, your oxygen levels drop. Your brain panics and sends a jolt of adrenaline to wake you up, which spikes your blood pressure. Doing this dozens of times a night eventually leads to permanent high blood pressure. Heart disease and stroke. The constant inflammation and vibration from snoring can actually cause damage to the carotid arteries in your neck, increasing the risk of stroke. It also puts you at a higher risk for arrhythmia or irregular heartbeats. 2. Brain and mental health. If you aren't breathing properly, your brain never reaches the deep, restorative stages of sleep. Brain fog and memory. Chronic snorers often struggle with focus, short-term memory loss, and a decrease in cognitive function. Depression and anxiety. Lack of quality sleep messes with your brain's ability to regulate mood, often leading to increased irritability. 3. Physical safety risks. Daytime fatigue. This is the most dangerous side effect. Snorers are significantly more likely to be involved in accidents because they suffer from microsleeps. Weight gain. Sleep deprivation messes with your hunger hormones. It makes you crave sugar and carbs. 4. GERD. Interestingly, snoring can cause or worsen acid reflux. The gasping motion created when your airway is blocked creates a vacuum effect that sucks stomach acid into your esophagus. Stopping snoring usually requires a two-pronged attack: immediate physical adjustments and long-term strengthening to fix the root cause.